Bienvenidos, and a very warm welcome to you all to this International Council of Nurses hosted webinar for the Latin American countries. Colleagues, we have translation for this webinar. The button at the bottom of the screen, click on the language that you would like for the translation, and that will be available throughout our session today. We have 2 hours and we want to take the opportunity to brief all of you on what has been an extremely busy first part of this year, and particularly the month of May. We want to share with you the range of work that ICN has been involved in, but we also want to hear from you about your priorities, the work that your associations are leading on, and then we want to have some opportunity for discussion as well about our joint work together and what we need to focus on going forward. So that very broadly is our plan for the next 2 hours. But firstly, let me turn to the ICN President, to Dr. Pamela Cipriano, to offer her welcome and her opening remarks. Madam President, the floor is yours.
Thank you, Howard. And hola, all of my colleagues. I'm very pleased that we are able to have this first regional session with all of my colleagues and friends from the Latin American countries. As Howard said, this is really a wonderful opportunity for us to share the work that we're doing on behalf of you and our NNAs around the world and all of our nurses, but even more importantly, to hear from you some of the activities and issues that you're dealing with so that we can better understand how ICN can be supportive of your work and really amplify the impact of what we do. I'm pleased to welcome, and you'll be hearing from them later, 2 of our board members, Nora Aloisa Barona de Peñate and Jose Luis Cabo Serrano from Spain. And again, Nora, you know very well from El Salvador. You'll hear from him shortly. And then also a special guest who's with us, who joins us on our panel, Sylvia Cassiani. And so we're very pleased to have her as one of the advisors for nursing in the Pajo region. In the time that we have this morning, we will share with you some of the critical work that has been occurring in the policy arena with our key colleagues at the World Health Organization, with our partners, the International Confederation of Nurse Midwives and others, and also some of the work that ICN has produced very specifically that ties many of our initiatives together related to protection of the workforce, amplification of the need to invest in nursing. And you'll hear a lot more about that. But even in addition to that, one of the things that won't be prominent on our agenda today is the work that we've been doing through the Nurses for Peace campaign. And we want to thank all of you who have signed on to the petition and been supportive of that work, perhaps with donations or activities of your own with your NNA. This humanitarian response has been met with overwhelming success and appreciation by our colleagues in Ukraine. And we just want you to know that as we consider those sisters and brothers who are suffering in great measure, they know they have all of our support, which has also been incredibly meaningful. As was mentioned, May was a very busy month, as I'm sure it was for many of you too. It's the culmination of many academic organizations and their graduations. It's also a time for gathering across our associations, a lot of planning that many of you have been involved in as you're looking at implementation of ways to recover your workforce, to address their well-being and their protection, as well as planning for the future for how we can have a new status emerging from the effects of the pandemic. So we look forward to hearing from all of you. I was pleased to see we have 14 or more of our associations who are going to make interventions today. And I'm so pleased that so many of our Latin American countries are able to join us, both with leaders and many of the members, to have this conversation today. And again, you are the first. We've committed to having regional meetings with our associations. And so we're excited that you will be our first conversation, in which we believe will help us stay as relevant as possible and up to speed on all of the activities and issues of concern. So thank you for joining us today. We look forward to your sharing with us, as well as an active panel at the end. So now I would like to turn things over to one of my ICN board members and the El Salvador Nurses Association, Dr. Nora Eloisa Barona de Peñate. Nora.
Bueno, gracias. Un saludo para.
Thank you. Greetings to everyone. Thank you, Dr. Pamela, as the Madam President of the ICN, Dr. Howard Cotton, the CEO of ICN. I would like to thank you, first of all, for your availability and the interest that you had expressed to gather the region of Latin America, to be able to have this meeting, which is a very important meeting today. I would also like to thank the presence of Dr. Sylvia Cassiani, with whom we had been working in projects for Latin America. We're very pleased that you can be with us as a guest in this meeting. Also, Ms. Concepcion Chavez, as President of the FEPEN, she's also here. And obviously, greetings to my friends and colleagues, presidents of the different NNAs and colleges of the region of Latin America and Mexico, which is also present here in this meeting. We would like to tell you that we're very pleased, both the board team, I'm here with Jose Luis Cobos as part of our team in the support with the language. He has been giving us a great support with the Spanish language. I know that Spain has been supporting us, and I thank you, Jose Luis, for being here, and also thank you to all the ICN administrative and technical team. It is very important that here in this meeting we can have a brief of the important activities that have been conducted in May, as Dr. Pamela said, but above all, we are very interested, and this is an interest from the NNAs and colleges and the presidents, to express their priorities, their needs, and especially they would like to talk about how the ICN and the WHO and PAHO can also help us in some important activities, because Latin America, among its priorities, we have the needs and the gaps in the deficit, in the shortage of nurses as one of our top priorities. And also we need to work together. We need to undertake a joint work to be able to strengthen employment for nurses in our region, which is an urgent priority to be able to provide the population with good quality healthcare. I know there are many different needs, and each president of the NNAs will have the opportunity to express in this webinar, which is the start of many activities with our region. Thank you very much for the participation of all of you, and thank you for the opportunity given to me to participate.
Madam President and Dr. Nora, thank you both for your opening remarks and words of welcome. We have indeed got a lot of ground to cover, and we're going to start the next 20 minutes or so just to give you an overview of some of the key ICN activities over the last few weeks. Colleagues, at the very end of our session, well, there will be the opportunity for some questions, answers, and discussion as well. Use the buttons at the bottom of the screen if you have a question that you would like to put and that you would like our panel to respond to later on in this session. Put your question in the Q&A function. We're monitoring that, and we will use those questions later on. Feel free to use the chat to talk to each other, to share documents or views, but if you can keep your questions in the Q&A button function, that would be great. I'm going to start to say a little bit about International Nurses Day this year, and we have some slides that we're going to use. So Cyril, if you can share those slides, please. You all know, of course, that 12th of May was International Nurses Day, and you can see the image there of the front cover of the ICN publication, and our title, Nurses, a Voice to Lead, Invest in Nursing and Respect Rights to Secure Global Health. We were delighted that this has been downloaded many thousands of times. It's been used around the world. Many countries who took this theme as their theme for International Nurses Day. We decided on this theme for a number of reasons. The first, the need to invest in nursing. Nora has already highlighted that shortages are a priority for Latin America. Shortages are a priority for the world. We know that we went into the pandemic 6 million nurses short. ICN has done some work to look at the impact of the pandemic. We think that number could even double, and including people who are aging and will leave as a result of retirement, we might need to be replacing up to 13 million nurses around the world. The world simply has done not enough to invest in nursing education and nursing jobs to both recruit and retain nursing staff. And that's why that is a central message of this year's IND publication. But we've also mirrored and reflected the global strategic directions for nursing and midwifery. This will be very familiar to you. It's a strategy which ICN worked with WHO to develop, and it includes the need as well as to invest in jobs, leadership, and nursing practice. What this publication, what the IND publication does, is to bring you both the evidence as to why investment in all those areas of nursing is important, but it also provides policy recommendations and practical actions that you can take in order to deliver on those strategic priorities. But colleagues, what we also did was we added 2 new priorities. We added the safety of nurses and their colleagues, and we added the health and well-being of nurses. And we did this very deliberately because we had seen through the pandemic the tragic loss of nurses and workers' lives as a result of contracting coronavirus. We did work with WHO, which suggests that that could be as much or even more than 180,000 colleagues who lost their lives globally. We saw high infection rates. We saw a lack of equipment in our health systems, essential equipments to enable health workers to provide high quality and safe care. We saw attacks on health workers, abuse and discrimination, sometimes from those people who were opposed to vaccinations. But more recently, we have seen the situation in Ukraine has developed. We have seen the deliberate targeting of healthcare facilities and healthcare staffs. And those are key reasons why we said safety and protection must be a key priority alongside the health and well-being of nurses. We have documented the mental health and psychological pressures that nurses have been under. We believe that that is currently one of the key drivers for nurses who are quitting and leaving earlier. It's an area which we believe needs much more attention. We also highlight the global documents and agreements that already exist that speak to these issues. There is a WHO Care Compact which sets out all of the global policy that exists in relation to nurses and health worker safety. We know that we have an ILO convention, Nursing Personnel Convention, only 41 countries are signed up to. So this document also signposts to the global documents, requirements and standards that exist. And we said in this title, as well as investing and respecting rights, we do all of these things, not because it's because it's the right thing to do by nurses to respect their rights and to protect them, but we know that when we invest, support, protect and respect nurses, we secure global health. The recent the WHO reported that 66% of countries said that shortages of health workers were a key reason why their health systems were not functioning at full capacity. And it's because the shortages result in a lack of healthcare that we have also, in our title here, reinforced the need to invest in nursing to secure global health, not just to prepare for future pandemics, but to deal with all of those other health needs and unmet health needs we know have been building up during the course of the pandemic. The campaign, International Nurses Day, just to share with you, has been one of the most successful. And you can see here that the hashtag for IND has been used by more than 200 million people and voiced to lead by nearly 100 million as well. So it's clearly resonated and been picked up by nurses right the way around the world. Next slide, please. One of the things that we always do, colleagues, in those IND publications is to include case studies of nurses, so we can point to and you can use in your advocacy real life examples of where nurses already are delivering through their practice, through new models of care, where they are showing what the solutions that nursing can bring to those health challenges that we face. And we were delighted this International Nurses Day to also have the launch of the project that we've been working on for the last year with the BBC, the launch of the website Caring for Courage. Go back to the previous slide, please. That's the slide. And this is what the front page of that website looks like. This is the link here you can see to that website. Please do look at it because it includes 13 films, short films, produced by the BBC, BBC quality films, but highlighting nursing innovation and practice right the way around the world. These films and the partnership with the BBC, we know will take the reality of nursing to a much bigger audience. But look at them, please, because I think you may want to use some of those films in your own lobbying and advocacy. And as you've heard, the President has already mentioned that we launched Nurses for Peace just a few days after the invasion in Ukraine. We continue to talk regularly to our colleagues in Ukraine. The President and I spoke to them most recently just last week. We are providing support to them directly, and we are also working with associations in neighboring countries to Ukraine, where nurses at the forefront are providing the effort to support refugees. The last year, as well as the situation in Ukraine, has reinforced how nurses are also integral to building peace, but responding to situations where conflicts emerge and tensions exist, and have a peacekeeping and a peace building role. I'm now going to hand back to the ICN President, who's going to share with you a little more about the work that we did during the Triad meetings this May. Madam President, back to you.
Thank you, Howard. If you'll go back one slide. Now, there we go, that one. Thanks. So some of you may not be familiar with the Triad meeting, but it is a joint meeting held with the World Health Organization and the International Confederation of Midwives every other year. And it is an opportunity for the leaders of the National Nurses Associations and National Midwifery Associations, particularly the workforce leaders at the World Health Organization, the regulators, and the educators across the world to come together around an agenda that, again, really addresses how we strengthen nursing worldwide. And so, again, the chief nursing leaders of every country, the NNA leaders of every country association, and then the regulators. This year we had a virtual meeting, which again, we're hoping at some point in the future that we will be able to be face-to-face again, because we know the dialogue is so important. But we did have over 650 delegates who were signed on to the virtual meeting, representing over 165 countries. And the meeting was held May 9th through 11th. We had some really wonderful panels of NNA leaders who really demonstrated the work that they're doing together across the different entities and leadership groups. Really, the goal of the Triad is to figure out how do we together advance nursing and midwifery to support each other and to garner the strength and support, particularly of the World Health Organization, in our efforts. You may recall that the Global Strategic Directions for Nursing and Midwifery, which were published a year ago, was going to be the focal point of this meeting and that discussion. As you also heard Howard say, our materials and preparation for International Nurses Day were directly aligned with the messages and the work streams that we anticipate will become the major focus over the next couple of years to implement these strategic directions for nursing and midwifery, which again, the focus in the document is on 4 major areas to invest in: jobs, leadership, education, service delivery, and ICN has highlighted very specifically these additional needs of safeguarding and protecting the workforce and focusing on the mental health and well-being. If you go to the next slide, please. If you go to the next slide, please. The culmination of the Triad meeting is a document that lays out the commitments that come from the discussion, that come from the planning that goes into the Triad meeting. And what you will see consistently when you go to this document is that we are calling for investments in many aspects of nursing. We know that there has been an underinvestment in nursing and the nursing workforce. And as you know, and as we have repeatedly put into our publications, we've amplified in International Nurses Day work, we must invest in nursing if we want to have universal health care, if we want to have a reduction of preventable deaths, if we want to be able to be prepared for pandemics, and if we want to recover from the devastating workforce effects of the current pandemic. So what you will see repeatedly is a call for investment to restore essential services, to be able to increase our workforce capacity, to be able to increase the education of workers, and be able to create a safe and supportive environment, which goes along very much with respecting rights. As we've seen in the again, discussions that were leading up to the creation of the statement, there were many effects of the pandemic that disrupted health services. We know that in many cases, nurses were becoming ill. They were overworked, highly fatigued, highly stressed, and really unable to continue to deliver services in some areas. So we've seen sickness, we've seen retirements, we've seen intention to leave. We've seen higher rates of mental illness and actually suicide rates in some countries. So we know that we must support our nursing workforce to maintain the delivery of essential health services. So we can't have underinvestment. We must have new investment in all of the areas of nursing. And that means also adequate staffing, the conditions of work, improving safety and fair pay, career opportunities, professional development, all of the things that are important to maintaining a workforce. We also are calling for accurate national data. If you'll recall the State of the World's Nursing Report that came out over 2 years ago, had some data that we were concerned was not necessarily aligned with and supported by our national nursing associations. And we want to have that report redone with more current data, particularly post-pandemic hiatus so that we can see what actually has happened to the workforce as we fear a significant attrition. We're also asking for informal dialogue to be able to reach international decisions around the investments that need to happen to strengthen nursing for universal health coverage and primary health care. So the document is really a call to work together with our government leaders, with our other policymakers, with our other associations to be able to accelerate the implementation of the strategic directions for nursing and midwifery, to be able to make sure that we are strengthening our capacity, that we are redefining how we work in teams, accelerating some of the use of innovations like more telehealth services and digital education and learning, and making sure that we use lessons learned certainly throughout the pandemic, recognizing the essential role of nurses to achieve health as well as maintain healthcare delivery. As you will also hear a little bit more about, there were a number of significant discussions that followed in the next week in the World Health Association meeting, Health Assembly, that reinforce once again the kinds of things that we need for health worker safety, what we need for global practice and ethical recruitment and migration strategies following the ILO convention. So there is a synergy among all of the work of ICN, the work with our partners, the work with WHO. So this is a really important and critical time that every one of our countries across all of our regions are working together to implement the recommendations and strategic directions, because we know while the spotlight is on nursing globally right now, this is an opportunity we must seize to get the investments that we have been asking for that now should be very apparent that the world needs to support nursing in order to ensure healthcare delivery and be able to achieve universal health coverage. So we know our place is absolutely critical in that path. So I'm going to turn it over now to Erica Burton, who's going to talk with us about some of those critical decisions and outcomes of the World Health Assembly.
Thanks so much, Dr. Cipriano. Hola y buenos días desde Canadá. I am Erica. I'm a nurse consultant on the nursing and health policy team at ICN. And I know some of you were able to participate in the 75th World Health Assembly, which was held between the 22nd and the 28th of May this year. I hope you enjoyed the discussions. It was a very full agenda this year. And I do believe that if you did miss any of those, the recordings, which do have a translation into Spanish, are still available on the 75th WHA website. So I encourage you to go and listen to some of those sessions. So the theme for this World Health Assembly was Health for Peace and Peace for Health. And ICN had a delegation of over 70 nurses from over 40 countries. And that included ICN's National Nurse Association member representatives, representatives from ICN affiliate members, the ICN Board of Directors, the Global Nursing Leadership Institute, or GNLI, both scholars and alumni, and ICN staff and consultants. And the delegation this year took place in a hybrid format. So the World Health Assembly was held both virtually and in person in Geneva. So most of our delegates took place virtually from their locations, but we did have a small group of ICN staff in person in Geneva. That included Howard, our CEO, and Hoishan Fokolade, who also co-led the ICN delegation this year. And they were able to have a number of bilateral meetings at the ICN office and at the WHO. One of these meetings was a briefing on the Nurses for Peace campaign with Ukraine's Deputy Minister of Health and with WHO Chief Nurse Elizabeth Iro. So starting to get back into in-person meetings and seeing the impact of these. ICN also had a student delegation. We had 14 nursing students and early career nurses from all of the 6 regions. And the ICN Nursing Student Steering Group members who had participated in the WHA last year were able to mentor these students through their first WHA experience. So that was really exciting. And now, as ICN is in official relations with the World Health Organization, every year we're invited to make statements on the WHO agenda. So this year we made 6 interventions, which you can see on the slide here. And they were delivered remotely on video. And the first intervention that you see on the list there is the Human Resources for Health agenda item. And this agenda item was hugely important this year, as it is every year. But this year had several sub-agenda items and important WHO HRH pieces of work, including Working for Health, the draft 2022 to 2030 action plan, the Global Health and Care Worker Compact, something that ICN contributed to, the WHO Global Code of Practice on international recruitment of health personnel, which I know you'll be very familiar with, and the Global Strategy on Human Resources for Health, the Workforce 2030 document. And so in our intervention this year, ICN highlighted that to the WHO that the biggest threat to global health from our perspective is workforce shortages. We intervened also on strengthening WHO preparedness for and response to health emergencies. In this intervention, ICN told the WHO that it is nurses and healthcare workers who, of course, had to directly deal with the consequences of a lack of pandemic preparedness. And this is the reason why ICN really strongly supports the development of a new international instrument, which there have been long-standing conversations about over the last year or so, on pandemic preparedness and response in accordance with the IPPPR recommendations. We also had an intervention on infection prevention and control, where we highlighted the central role of nurses in IPC education for both patients and families, and that nurses are leading and supporting IPC teams. We let the WHO know that we will continue to contribute and direct our work to achieving safe care delivery and health security, one of our important priorities that we've had on our agenda for the last few years. There was also an intervention on the public health dimension of the world drug problem. And so this intervention highlighted that, as is espoused in the ICN Code of Ethics for Nurses, nursing practice treats all people with respect, dignity, compassion. And so we were supporting this statement in the direction of a harm reduction approach, which reduces these harmful health, social, and economic consequences of substance use, and really emphasizing a human rights approach. The fifth intervention was on the Global Health for Peace initiative, which Howard mentioned earlier on. And in this intervention, ICN highlighted that nurses are really influencers of peace, peace diplomacy and peace building, and that nursing care is centered on neutrality, reconciliation, and healing. So just highlighting the role of nurses in peace. And of course, here we mentioned our Nurses for Peace campaign as well. And lastly, we had what was a constituency statement. So this year, groups of non-state actors or civil society organizations got together to deliver constituency statements on behalf of a number of organizations. And this one was on the prevention and control of NCDs, a huge agenda item with, I think, around 14 sub-items. So it took up lots of the agenda this year. And this statement was delivered by us, pharmacists, pharmacy students, physicians, physical therapists, the Federation of Biomedical Lab Science, and the Federation of Surgical Colleges. And the constituency noted its support for the draft implementation roadmap for the Global Action Plan for NCDs, and urged the member states and WHO to work closely with health professionals to ensure its successful implementation. Next slide, please. So during the WHA, the newly re-elected this year Director General of the World Health Assembly, Dr. Tedros, tweeted, "Nurses have shown over and over that they are the cornerstone of health around the world. I salute all of them for their tireless dedication and resolve. Thank you, ICN, for your strong collaboration with WHO to advance nursing. And this is a photo of course, our president and our CEO with Dr. Tedros. And so as the years have gone on, and ICN has been really present and had a very strong delegation and strong voice at the WHA. We are now seeing tweets like this, which really is an attestation to our dedication and the importance of this meeting, and then what that means for the rest of the year in terms of ICN's priorities and priorities for our NNAs. So that's just a quick highlight. We will have a WHA report that we release next month. This will give a summary and some ICN and nursing policy considerations that are linked to each of the key agenda items. There are about 14 or so in there. And it'll describe some of the activities around the 75th World Health Assembly. So I encourage you to look out for that. It will be in Spanish as well, of course. Really important policy document, not only to highlight what went on, but sort of where to focus on in the coming year on these important topics. Thank you so much.
Thank you, Erica. Thank you, Madam President. Erica, thank you particularly for your leadership of the ICN delegation during the World Health Assembly. I have no doubt that it is because of the strong work that you led and the support of all of those who were on the delegation that Dr. Tedros tweeted this message to us, because he clearly heard you and the delegation very loudly and clearly as the voice of nursing. And as Erica has said, whilst an awful lot of this information is available on our website, we're putting the finishing touches to a full report of all of the interventions, all of the activity around the World Health Assembly, which will be available to you as well. We can take the PowerPoint slides down now, please. And it is my very great pleasure to also welcome and introduce Dr. Sylvia Cassiani, who needs no introduction to you, who you know very well as the Regional Advisor for Nursing for PAHO. Sylvia, thank you so much for finding time to join us, and we see regularly the incredible work that you're leading for nursing on behalf of nursing from PAHO. Please do tell us a little bit more and bring us your updates as well. Over to you, Sylvia.
Thank you very much, Howard. Thank you, my dear colleague, President of ICN, Pamela Cipriano. Now I'm going to switch to Spanish. So, vamos hablar en español ahora.
Okay, so we're going to continue in Spanish. So thank you, Howard. And thank you to my dear colleague and president of the ICN, Pamela Cipriano. It's a pleasure to be here today with Nora, who is a dear colleague and ally in the work that we do. I would like to say hello to all the participants who are here today, to Maria Concepcion, our official PAHO partner, and to all the attendees. We are now at a very important moment, and I'd like to congratulate the ICN for having the initiative of holding this meeting. I think we need these kind of meetings more frequently, and especially to work together on nursing in this region. As we saw from the Triad Meeting of 2022, there have been different debates and commitments that we've all made, and would like to highlight a few of them now. The first one is to accelerate the implementation of the strategic directions of nursing and midwifery. this is a document that we all should have. We should have it near us. We should have a look at it on a daily basis. We should always make reference to it because all the recommendations are there, all the advice is there for the nursing and midwifery strategy that we want to implement. I would also like to mention another section of that document is the fact that, of the Triad meeting, and is that we need to protect all of our workforce.
So you can see here that the main word is investment. It is the key word we have to use at all times when we're going to discuss, when we're going to present our work, when we're going to disseminate what we do. Between March and April, PAHO has been working with Nora, with Michelle and with Ms. Lero, and also with FEPEN and with the members of CARICOM to discuss the joint working plans we have and to prepare just one single document which will cover the political focus, the decision-making and the dialogue, together with the indicators and the partners and the instruments and resources that together we have to advance nursing. It is a document which is just a draft at the moment. We have some key information gathered, and I believe very soon it will be ready to share it with you and to tell you which each organization had been working on in this regard. The second aspect I would like to share with you just one sec, let me see if I can share my screen. Yes, I hope you can see it. Okay, so this is a topic which is the triad on the call to increase investments, which ICN has been working so hard on this. It has been a very happy coincidence, really, to have these documents also from the WHO and the PAHO. So in May, we launched the document titled The Strategic Importance of National Investment in Nursing Professionals in the Region of the Americas. It is a policy brief. It is a document organized jointly with the University of Johns Hopkins and the Nursing School of Johns Hopkins University. And this document generated an infographic, which you can see here in the screen, which shows the investment in 4 priorities. First, training, employment, nursing practice, and leadership. So within each one of these 4 areas, we suggest priorities for investment. You can and you should use this document in your own meetings when you're going to meet with government representatives, whether they are at the municipal level, the regional level of your countries. And this infographic shows clearly where we should be investing. It is very much aligned with the global direction of nursing and midwifery. We have disseminated, and we're going to keep on disseminating this infographic. I would also like to tell you that in a few days or even months, better saying, we are going to launch the Community of Practice for Nursing in the region of the Americas. It is almost ready, and it is going to be a forum where we're going to have a discussion area where the nursing topics of the region can be debated and discussed. Also, I would like to invite you to have a look at the website of PAHO Nursing, where you have all these documents and more documents. So we have a long way to update the regulatory framework to improve the quality of training and of research We have also lots of things to improve the workplace conditions and the nursing practice. And I'm sure that together we will be able to make things better. Thank you, Howard. Thank you. And I would like to give you the floor again. Thank you.
Sylvia, thank you so much and for sharing those really important updates and documents. And again, I think we can all see the close alignment on some of the key priorities that we all share. Colleagues, we're now going to move into interventions from many of the associations from across Latin America. We have 15 colleagues who have kindly agreed to give us an update. That does mean that each intervention, I'm afraid, will just be just a few minutes, just about 3 minutes long. I will call each of you to take the floor, and you will have a warning, a 30-second warning that my colleague Pilar will give as well. So if you hear another voice when you're speaking, it's just a warning that your time is coming to an end. The first colleague, Ruben Lastro. Ruben, the president of the Argentinian Nursing Federation. Ruben, the floor is yours.
Bueno, muchas gracias, estimados y queridos.
Thank you very much, dear colleagues. On behalf of Dr. Pamela Cipriano, I would like to greet all the colleagues who are listening to us in this webinar. It is important to highlight the impact that in our countries has had. I mean, I'm talking about the situation in Latin America. I'm talking about the impact of COVID-19, and also very recently the impact of the war in Ukraine. I mean, this is causing a shock in the world economy and an increase in inflation. The inflation has increased. It is also important to remember that in Argentina, we are the 5th country in the world with the highest inflation after Venezuela, Zimbabwe, and Turkey. So it is important to have this into account, and this has had a great impact in our profession. Now, with regards to the healthcare sector, we have 82% of the population in Argentina has been fully vaccinated. We are in the 4th COVID-19 wave. It is important to acknowledge the importance of the vaccination campaigns because we can also have some hope towards the future. It is also important to highlight that in Argentina, 37.2% of population is poor and 8.2% is classified as extreme poor, in extreme poverty. Argentina, we are 235,000 nurses, and we don't, I mean, this reality also affects us that I'm talking and sharing with you. We do have different realities in the nursing profession because we have 24 provinces which are federated states, each one of them with their own legislations. That is why it is important for us in Argentina to put in a public agenda the ratification of the 149 Pact of the ILO that hasn't been ratified by Argentina. Also, we have the problem of nurses having to have different jobs. We cannot have a decent job with just one salary. We have to work in different jobs. We have to work double. It is important to have this into account. And from the Argentinian Federation of Nursing, we support all the struggle. That means the defense of the better conditions in the workplace for nurses and the hierarchization of the conditions with regards to the professional studies in those provinces where we don't have this training, this formal training. We lack nurses. It is important to have this into account when we think about the government-led initiatives. It is important really to have into account the activities of the national authority in nursing, but also we need public policies to really work on this, and we need more budget at the national level. So from the Argentinian Nursing Federation, we would like to support the ICN and the SDGs because we want to make an impact on the investment in all the different aspects. So we would like to greet you once again and wish you a great day. And also, I hope our issues will be solved in all our countries. Thank you very much, my dear friends.
Thank you, Ruben, for a very comprehensive but also succinct presentation. I can see lots of positive reaction in the chat to that. Next, we're going to go to Bolivia, to Elba Oliveira from the College of Nurses of Bolivia. Elba, the floor is yours.
Sí, buenos días a
Good
todos.
morning. Good morning to all the presidents, to the ICN president, Madam President, to Harold, and to the president of FEPEN. Yes, I think we share the same issues as a country. In Bolivia, we have about 14.19 doses of the COVID-19 vaccine applied. We had used Sputnik, Sinopharm, AstraZeneca, and Johnson's vaccine, but unfortunately, this high amount of dosage is not according to the expectation from the Ministry of Health, because unfortunately, we have a very vulnerable part of the population who hadn't been vaccinated. And now we are in a higher rate. We can see higher rates of infection. And since yesterday, the decision has been made that the vaccine is going to be applied in the education centers. But as it has been already said before, the main issue has to do with the economic aspect, like the salary gap that we are facing. When we talk about the healthcare team of professionals, and also we have the problem we have here in our countries. We don't have an authority, we don't have a chief nurse at the government level, and this also makes all these issues very weak, and also the development of all the proposals we have are sort of weakened. But within the context of our efforts and commitments, we're trying to really work with the different resolutions, especially with the latest statements done by WHO to support nursing and midwifery. These are important aspects to be able to secure part of this transformation process. And above everything else, there's a lot to do from the region, yes. And one of the main elements which interests us is the 149 agreement. We've tried to make the ratification, but we're not having this positive answer. The document, which has been published in February, it is a very interesting document with a very impactful cover. So we sort of have to ask us what happened, how are we classified, but the content is very good. And I think as an ICN, as an international council, it has to have a more active, more sort of active role. So we can also have the NNAs in the WHA to really be part of these important and deep debates. As in February, we couldn't participate, nurses couldn't participate in the WHA debates. Well, with that, we are always going to keep on contributing from where we are to try to really fulfill and to obey all the established declaration. We've been at the Triad meeting, we've been to the WHO meeting, so we have many elements to work with. Thank you very much for this opportunity. Thank you for inviting us. I just want to tell you that we are in this fourth wave, and also we have a higher rate of COVID-19 infection, so I think we still have a long way to go. Thank you very much.
Elba, thank you so much. You're absolutely right. We have more to do to get more nurses on the Ministry of Health delegations at WHA. We did have a number this year, but there is still, of course, more work to do there. I'm now going to go to Carmen Luisa Madriz, the president of the Costa Rica College of Nurses. Carmen, the floor is yours.
Hola, muy buenos.
Hello, hi, good morning. I'm Carmen Loaiza from Costa Rica. It is a great pleasure to greet you. Hi, Sylvia, Miss Pamela, Miss Nora. So happy to be able to share this time with you. So Costa Rica has very similar situations to the one my colleagues had mentioned. However, I would like to highlight one particular one, which is what we have is the carers in our country. We have just defended an act promoted by the government to increase the number of carers. We have 52 institutes training patient assistants or carers. And we have also the prosecutor's office, which is also working very much in the defense of our profession, in trying to avoid people who are not trained as nurses, as registered nurses, to come to work as nurses. And also, after a long and hard effort, we had the result that the College of Nurses would be included in the definition of what is a basic care for the daily activities and what is a management of the scientific care for the general population. I think this is a great advancement for us, a great development. We also face a very serious problem in the public healthcare network. 75% of our nurses are hired as nursing assistants, and also, well, basically they will have to accept these very low and precarious conditions because they have to eat. But this also causes great problems in nursing because for them, they are very frustrated. This generates lots of internal conflict among nurses because today I want to be a nurse. I want the nurse to leave because I am in a list where I want to go higher in that list so I can get access to a better job. So this is generating lots of problems and a lot of issues. We have more than 5,000 nurses who are not having a very good job. I mean, they are hired as nursing assistants. Also, we have a serious problem in the training, the official training at the universities. And this condition of having to accept precarious jobs if they are weak in the training, the college, in this precise moment, we are working very, very hard in training. We're working with a developed unit to strengthen the knowledge. However, this condition of having to accept this precarious job is very hard because it's very hard for the nurses to really have a good quality training. During the pandemic, we've also seen where the supply of nurses, I mean, the demand for nurses went down to zero. We basically didn't have much supply. So we have a huge problem. The public entity, we have a restructuring process, which is also threatening our legislation. Thank you so much for allowing me to say what I wanted to share with you. I believe Article 149 of the ILO is key to be ratified for the different countries. It would be really, really helpful to us. Thank you very much. Greetings to everyone. Thank you from Costa Rica.
And Carmen, thank you, and also for the very important points about the issues within different cadres of nursing and nursing workers as well. We're now going to go to Ecuador, to Maria Gerendina Merton, the president of the Ecuadorian Nurses Federation. Maria, the floor is yours.
Muy buenos días.
Good morning, everyone. Greetings from Ecuador. Greetings from Ecuador. Greetings of unity and identity and of organization from the nurses from our country. I would like to highlight that as our previous speakers and colleagues, we are facing very dire difficulties with our commitment, with our work. When we position ourselves as the leaders of the Ecuadorian Nursing Federation, we would like to implement many things. We are very grateful to ICN and to FEPEN for all the contribution in the scientific and technical research areas to be able to debate the help we are dealing with here in Ecuador. Previous governments had weakened our institutions. Previous governments also hindered that the nursing profession had a main role in the care we provide, although when we say and we know that they are the cornerstone of the healthcare system, however, we are not acknowledged, or the acknowledgement towards us is not enough. There's a huge difference of salary between the public and the private healthcare services in our country. And due to all the politics, the neoliberal politics had increased the salary gap, and it is becoming an employer sector, which is very important, this private healthcare network. However, the conditions in terms of salary and the working conditions are very precarious. We are both male and female nurses. We are working to strengthen our organization. We are about 22,000 nurses in our country. However, only 10% of those is organized. That is why our work is focused on this organization in extending the member base of the federation to strengthen the leadership, to develop training, continuous education, because basically the fourth level, the higher education level, is very precarious, really. It's not of a very good quality in our country. We're also working harder so that at the public level we can have a greater participation in the power structures, in the decision-making entities, both at the ministry level and also at the level of the social security entities. Therefore, I know that from the ICN you can support us to lead our work in all the policies that ICN has implemented. Thank you so much to everyone. I would like to thank you for this initiative of looking at the participation of these different NNAs in these events. Thank you very much.
Maria, thank you. And again, thank you for covering so many important issues in what I know is just a short period of time. We are recording all of these interventions and we'll be summarizing them. Don't forget to put your questions in the Q&A chat if you have them, colleagues. We're now going to go to Guatemala, to Ingrid, Patricia, Figaro, Salam, the president of the Guatemalan Association of Professional Nurses. Ingrid, the floor is yours.
Gracias, buenos días a todos.
Thank you. Good morning to all of you. I would like to salute you all from Guatemala. I was listening to Sylvia Cassiani, and what she mentioned is basically our priority in Guatemala. Indeed, we need to make our profession more professional, such as our colleague from Costa Rica said. We have people who are professionals, they are graduates, and they are still working as nursing assistants or technicians. So indeed, we need to continue working in those fields. We also need to invest in specialization because we have many people that have a lot of experience. They have excellent capacities. However, due to financial issues, they cannot continue studying in order to have a professional certificate or diploma. So as a part of our National Association of Nurses, we want to ensure that these colleagues can have a professional or a professional certificate that will enable them to access to any position, because they have received options and offers from abroad, but they need that professional and official certificate. We also need to ensure that the nursing profession is the same everywhere in the country, because we see there's a many differences, which leads to problems for all of us, all the nurses, especially as a result of pandemic. And we also need to promote leadership that will ensure that nursing is recognized, something that we've been looking for or searching for throughout our history. We want that professional recognition because society as a whole does not recognize what a nurse does and her education. We would also like to have established conventions or agreements with other countries, for example, through the FEPPN, in order to have exchanges with other countries, exchange of nurses, so we can share experiences and learn about the public health services of other countries, because we are aware of what's happening in other countries through the meetings that we've been holding. But I think it's very different if we send someone there, if someone has the possibility of working in a different health service and learn on the field. So I'd like to thank you from Guatemala for this opportunity. We understand that nursing is very important. We continue struggling here in order to continue with the vaccination campaign. We have advanced very little, but we are trying to ensure that everyone gets vaccinated. So thank you very much, and a friendly hug from me from Guatemala to all of you.
Ingrid, thank you, and also for reinforcing the importance of leadership. It is an issue which is central to everything that we do at ICN. I'm now Maldonado, number 8. Okay. Sorry, colleagues, we're just slightly rearranging the order of our speakers. So now I am going to go to Mexico, to Maria Teresa Maldonado, the president of the Mexican Federation of Nursing Colleges. Maria, the floor is yours.
Sí, muchas gracias, Dr. Howard.
Thank you very much, Dr. Howard. And hello to everyone from the Mexican Federation of Nursing Colleges. We'd like to thank you also, Dr. Pamela Cipriano, for having been with us in our Congress earlier this year. So the Mexican Federation of Nursing Colleges is an NGO which unites 30 different nursing colleges from Mexico. So we are the representative body of all nurses in the country, and we are strengthening our position through different events that we've held, especially building capacity and working together with our colleagues, because our profession isn't given enough credibility. Organized nursing through our federation has presented to the body that presents proposals to modify legislation. We have provided them with some proposals in order to improve the conditions of a nursing workforce, and because we haven't seen any results so far. We believe that what has been a burden to the development of the nursing profession in our country is different loopholes in the legislation. What my colleagues have already said is very similar to what we are experiencing in Mexico. So I'd like to take this time to request from the ICN to request the Mexican government to sign the 149 agreement of the ILO in order to improve the working conditions of nurses, and that their salaries are at the same level of other professionals who have the same educational level and the same responsibilities. We also wish for nursing professionals who have more important or managing positions in the public health service to have the same remuneration as other professionals, and not only to be appointed to those positions and only have the responsibilities, but that is not reflected in their salaries. And we would also like to request for our associations to be considered at the same level as those of other professions. So we would very much like for the nursing colleges to be the ones that define their budgets for their own professions in order to ensure that there is no shortage of drugs and other equipment. And the most important thing is to ensure that there is no shortage of workforce, because right now we are in great shortages similar to other countries, and sometimes we need to look for professionals in other countries in order to meet the needs that we have. In addition to all of that, we believe that this is all necessary to ensure a quality service for the population. Nursing needs to be considered in all the health policies. It shouldn't just be considered as an attachment to health services. And we need to ensure that the recognition that is given to nursing on paper has the adequate salary attached to it. Thank you very much for giving me the opportunity to talk to you here today.
Maria, thank you very much. And we hear you in relation to ILO. We can follow up separately on that. We are in very close contact with ILO here in Switzerland. We're now going to go to Honduras, to Ella Dianera Marquez, the president of the College of Nursing Professionals of Honduras. Ella, the floor is yours.
Muy buenos días.
Good morning. Hello to you all from Honduras. And thank you for giving me the opportunity to be here. Thank you to Pamela Cipriano, to Dr. Sylvia, to Nora. Thank you to all of you that have made this meeting possible and have given us the opportunity to express and share with you the situations that we're experiencing in our country. The reality in Honduras is very similar to what's already been described. Our workforce works in under very precarious conditions. We have 6,300 nurses with a high percentage of unemployed nurses. We introduced health model program that made the working conditions of our colleagues even worse. Our salaries are not equal, despite the fact that there is a statute where all our responsibilities and rights are established. However, that is not complied with at the national level. We have put forward many claims against the health ministry in order to improve our conditions and to ensure that there's some sort of regulation that protects our profession. The pandemic obviously made things worse, and it just highlighted the shortage of nurses in the public health service. It showed the need for having specialized nurses. The public university created the first group of nurses to work in ICU units, and also nurses specializing in OG. And there's another opportunity now to create a new specialization in OG and communal health in order to respond to all the needs and to the public health policies that we have and primary needs, in order to be able to adapt to the nursing structure that we have in the public health service. because in our country, we are currently in an epidemiological transition. So we are fighting against TB, AIDS, and other issues. So without further ado, I'd like to thank you for giving us the opportunity to speak to you here today. And I hope this is the first of many other occasions to share our views and needs. Thank you very much.
Ella, thank you very much. A very important point in there in relation to shortages, but also unemployed nurses. Colleagues, I'm next going to the National College of Nurses in Mexico, their General Secretary, Celia Avendano Rojas. Celia, the floor is yours. Is Celia there?
Buenos días. Saludos desde México. Mis felicitaciones por este gran evento.
Hello from Mexico. Thank you for this important event in order to understand what's happening in our different countries. We have the following priorities. We need to carry out some research in order to understand what are the real needs of the nursing workforce in our country, to understand what we are lacking. We need to also improve working conditions. Some people have 2 or 3 jobs in order to be able to make ends meet. We also need to continue with the legislation or the bill in order to improve the conditions of nurses in our country. We need to also encourage the well-being of nurses and the general population in order to improve their lives. We also need to continue with programs that were cancelled and which were focusing on different aspects of nursing. We also need to help nurses that have been infected with COVID-19. We also have an internal issue where we're trying to be able to access the association's main building because the former president won't hand it over to us. We also need to ensure that we have closer collaboration and communication with ICN in order to be able to continue with our leadership program. Whenever any claims are put forward by different associations, I believe that we need to be informed, first of all, before anyone else. So those are our priorities. Thank you for giving me the opportunity to talk to you here today. And thank you to the organizers for this incredible event. Thank you very much.
Maria, thank you very much. And we're now going to go to Nicaragua, to Maria Uceda Chavez, the president of the Nurses Association of Nicaragua. Maria, the floor is yours.
Wow.
Maria Uceda Chavez, yeah, I can see you. The floor is yours, Maria. You're just, I think you're on mute, Maria.
Ahí.
Perfect.
Sí, muy buenos días.
Good morning.
Muy buenos días para todas y realmente saludar a la presidenta.
I would like to say hello to Dr. Pamela Cipriano, the president of ICN.
Saludar a las representantes de la Junta Directiva.
And to all the members of the ICN board meeting, to Nora, José Luis Cobos, and to all of the presidents of the different associations, to Sylvia Cassiani as well. In the name of the Nurses Association of Nicaragua, which represents 21 organizations of the region, we'd like to transmit we're very happy to be here and for having the opportunity to hold this meeting and to be able to share the challenges that we are facing in the nursing world in our region, especially in Latin America and the Caribbean. So what are our main objectives as inside the FEPPEN? First of all, we want to strengthen the leadership in the different countries and in all the member associations. We strongly believe that by strengthening and creating new leaders in each of the countries and organizations, we will be able to do what the ICN is saying to us, which together with the WHO have said to us, that we need to make sure the voices of nurses are heard. We need to ensure that we make these voices be heard everywhere. And I think that that has been observed in the last few months. And what each of the presidents needs, as they have just said before me, we need the participation of all governments in the four main aspects of nursing, which is our education, employment, practice, and leadership. So from the FEPPN, we believe it to be vital to have this communion, to have this alliance between the ICN, the WHO, through the representation of PAHO, and the associations from the different regions. And together with all our representatives, I think that this union is very important in order to be able to work at the continental and regional levels and to ensure that each of our governments are going to invest in nursing. And before I end, I would like to say that the ministers of health have been present at the WHO meetings, but they usually come back to us and keep the results of those meetings quiet. They put them away, they file them away. And that's why we need to ensure that the governments are actually applying the recommendations of WHO. Thank you very much. Those are our main objectives. That's our request to you. And that's our position right now. Thank you very much.
Maria, thank you. An incredibly important point you make about governments, whatever they commit to when they're here in Switzerland, that they deliver when they get home. I sometimes think that the plane journeys home for ministers results in amnesia, that they have forgotten when they get home what they have said here. One of our jobs here is in our reports to make sure that you know exactly what your ministers have said when they're here at WHO in Switzerland, and we will help and support you with that. We're now going to go to Paraguay, to Myrna Garrido, who is the president of the Nurses Association of Paraguay. Myrna, the floor is yours.
Muy buenos días. Mi cordial
Very good morning. Greetings to the Madam President of ICN, Madam Cipriano, to Dr. Nora Barahona, to Dr. Jose Luis Cobo, and to our distinguished and very much good friend Sylvia Cassiani, to the presidents for the different NNAs, my gratitude and respect from all the region. I would like to say very briefly that here in Paraguay, we had made some developments, and we've gone forward, managing to secure a law that not maybe in the short run, but in the medium and the long run, we're going to have a better acknowledgement of the great team of nurses, and we have worked very hardly on this, along with the union and the unity of all the different sectors of nurses. And now we face the huge challenge of working and to occupy the decision-making fora so that the nurses, the male and female nurses, should occupy these decision-making fora in the country. There's a challenge we have to face, and for that we need the support from the ICN. We have to make visible the huge capacity that nurses have to be in the decision-making areas, in the decision-making fora. I just want to say this, that we do believe that with the new law here and with the implementation of this law, we will be able to achieve in a medium to the long run to suspend this very serious issue of nurses having to have 2 or 3 jobs, which really has a horrible impact in the quality of life and the quality of the healthcare provided by the nurses. Thank you very much.
Myrna, thank you so much for reinforcing some of those critically important points about decent work and good conditions. We're now going to go to Peru, to Josefa Sevas, who is the Dean of the College of Nurses of Peru. Josefa, the floor is yours.
Bien, muy buenos días. Quiero saludar.
Very good morning. I would like to greet the ICN President, Madam Pamela Cipriano, also to greet Maria Concepcion from the FEPPN, to our colleague Sylvia Cassiani, to all the dear colleagues who are connected in this virtual platform. First of all, as a Dean of the Peruvian College of Nurses, I would like to thank you for the opportunities that us, as the authority and the authorities representing nurses in our countries, I would really like to salute and to welcome these initiatives. The issues we face in Peru are very similar, and they are shared with the different countries in Latin America. First of all, we have more than 200,000 Peruvians who had passed away during the pandemic. 178 nurses passed away. However, during this COVID-19 pandemic, our country had a high number of contracts of nurses because we had a staffing crisis to work in the first line. So we had really did our bit, and we had been working in the different levels of healthcare. The problem we faced here in Peru are many, but I'm going to focus on 2. The main issue we face is that these nurses, most of them had been laid off. Today we have 10,000 nurses who had been laid off with a promise that there's going to be a new contract because they had been hired under the emergency situation for COVID. However, before COVID, we had a gap of 16,000 nurses, a shortage of 16,000 nurses in the whole country. We have precarious working conditions, and we have unemployment also. We have talked to the government. We've had unmet promises, but we have also put forward a legislative proposal which has to do with a correct human resources remuneration policy. And also we would like to ask ICN, I would like to request the authorities at the world level in the nursing sector to help us advocating with a document to our president and to the Ministry of Health, so that they can really work on this remuneration policy. It is not fair that nurses who had been in the first line, they say just thank you to us, and an average of 10,000 nurses, they're not hired, they cannot work because they had been laid off. On the other hand, we have 52% of nurses at the national level, they are hired. Nurses with a different range of contract types. Most of them, they are hired by third parties without decent working conditions. They don't have, for example, in a daily shift, they don't have allowance for lunch. If they have to work at night, they don't have allowance for dinner, differently from different kind of contracts where they do have these allowances. So the main issue we face is the type of contract. We want the same and the correct remuneration policy. The second issue we have is leadership. So here we have very well trained and very competent nurses, but they don't have access to these higher rank position. They are prepared, they are very well trained, they have a master's degree and PhD. We would like to have ICN to advocate in our favor for those nurses who are at the top in the as chief nurses in the hospitals to be remunerated, to be paid for that role. This is the second issue we face. Most of the nurses, they're not interested in taking over this high position rank as the doctors. Thank you very much. Come to Peru, and thank you. We have to do more of these meetings. Thank you very much. My greetings from Peru.
Josefa, thank you so much. Just in relation to your comment about ICN supporting proposals and solutions that you are putting forward, please do email us separately because we regularly write in support of our associations where they have proposed solutions to government and to show our support for those solutions, for those initiatives which associations are leading. So let's be in contact offline through email on that, and I'm sure that we can help with that. I've got 3 more interventions from President's colleagues before we go to our panel. Next, I'm going to go to Uruguay, to Sylvia Cassiani, the President of the College of Nurses of Uruguay. Sylvia, the floor is yours. Sylvia Cassiani from the College of Nurses of Uruguay. Sylvia, can you hear me? We'll come back. I think we'll come back to Sylvia in that case. We are very honoured that the president of FEPEN, Maria Concepcion Chavez, is also able to join us. So on behalf of FEPEN, President Chavez, I'll come to you now. The floor is yours.
Nuevamente saludar.
Once again, I would like to thank you, representing each one of the countries. Today, unfortunately, we couldn't have all the presidents of the different NNAs. Unfortunately, as I said, we cannot have the presence of all the presidents. I would like to greet everyone present here, Jose Luis and Madam President Pamela. But since it is the second time I'm invited to speak, I would like to reiterate the great necessity we have to prepare a working group between the ICN, FEPEN, WHO, and to prepare a short working plan. It could be 3, 4 aspects that will allow us to work on the work, on training, and especially which will allow us to work on the working conditions of our nurses. We've heard enough about the issues, like, for example, the summary from the Peruvian situation, a very critical and very dire situation, which is not very different from what happens in other countries. This is why I reiterate this request to create a working group, a task force, to be able to tackle each one of these aspects in a very specific manner. Thank you.
Thank you so much, Maria, again for those words. Let's try again now. Sylvia Cassiani from the Uruguay, the President of the College of Nurses of Uruguay. I can see you. Sylvia, the floor is yours.
She wrote in the chat that she has having some audio glitches, so.
Okay.
And she's going to join again. She's going to try to join again.
Okay, so we'll come back to Sylvia. We did have one pre-recorded video that was sent to us by Guillermo Rico Gonzalez from Colombia, the president of the National Nurses Association of Colombia. We're going to try to play that now. Cyril, are you able to play the intervention, the message, the video from Guillermo Rico Gonzalez? bear with us, colleagues. We've changed the order a little bit. Cyril, are we able to play the video from Colombia?
From Colombia, my greetings to our Madam President, Dr. Pamela Cipriano, and all the ICN working team. I would like to thank you for allowing us to participate in this webinar. Special greetings to all the nurses in the world. We would like to contribute to the nursing world today, and we have this national policy of nursing, human talent, and its strategic alignments 2020-2031, which had been published by the Ministry of Health in May. This policy has the three areas in which we are working very hardly already. One is to improve the working conditions for the nursing staff, education and training, and nursing leadership. It is going to be a very long and hard work already taking place in Colombia to take them to the employers, to take them to all the leadership levels in the country, so they can really have to be aware that the nursing staff is the backbone of the healthcare system, and we have to improve the living conditions and the working conditions of our nurses. We have to have a quick intervention because Colombia is working in migration. It is having to tackle the issue of the migration of nurses who are leaving our country. We are suffering this issue. Our nurses, they are leaving the country, and we have to work on the policy of retaining these nurses. We want to strengthen Colombian nursing and in the world as well. Thank you very much. Have a good day.
Thank you, Gilma. So pleased that we were able to share the message with you from Colombia, from their president, Gilma. So let us try for our last intervention from the presidents to go back to Sylvia Calviera. Sylvia, have you managed to reconnect with us? Let me pass the floor to you. Sorry, colleagues, I still think we have some connection problems from Sylvia. We have one other intervention from Cuba, from the president of the Cuban Association, President Edelmas. She has joined just now. If we can, President Edelmas from Cuba, if we're able to go to you, the floor is yours. President Edelmas, again, it sounds as though we have some connection problems. Colleagues, listen, we have had interventions from, I think, 14 or 15 presidents, which I'm hugely grateful to everyone. I can see President Edelmas. It's very good to see you, President Edelmas. The floor is yours.
Good afternoon to everyone. It's my pleasure to be here. Thank you to all the groups from the ICN and the different NNAs to allow us to be here with you and to share these words with you. I would like to say that since the 8th of October in Cuba, we had applied 37 million, more than 37 million of COVID-19 vaccines. It is the nursing sector who had led this initiative, and this has been acknowledged by the Cuban government. We had vaccinated more than 10 million people, including also the doses applied to the children. What are we doing after COVID? Well, in Cuba, we are working in the strengthening of primary care as the main entrance to the healthcare system. And also we realized because of the COVID that if we strengthen primary care, we will be able to guarantee a good quality healthcare in hospital care, both tertiary and secondary hospital care. Also, we have to have a different approach. I mean, this has a basically it's an approach to preserve the well-being, changing the mindset between action and positive health. So we are analyzing all the different indicators in the system, and more than reach a goal of the indicators, we want to propose healthcare-based indicators to help us to improve the health and the well-being of the population. It is this purpose which will allow us to increase the health control, taking into account the assessment of the chronic diseases and the vulnerable groups as the elderly, the teenagers, children, and pregnant women. What are we doing now from the nursing profession? We have 100% coverage of nursing in the healthcare system. When they basically finish the study, they have guaranteed the vacancy. Also, we had increased the cap in the nursing schools. It is important to have this excellent coverage to be able to provide the population with the nursing services. Also, we had increased the nursing specialties, so we have now created the master's degree in dentistry, nursing, and also in the nursing for the elderly. Also, in the healthcare, in the public healthcare law, we had also changed the law so that at a given point we can also work with nutrition. Also, we had a review of some other leadership nursing policies. In Cuba, we had the opportunity in 3 different times to have the ICN leadership. It is the leadership course in negotiation organized by ICN. And I would like to say that for us, we are ready to collaborate with the region. Now we want to start with the Central American group of nursing professionals of Central America and the Caribbean. I think it is an opportunity to collaborate and support everyone. Thank you very much for allowing me to say these words. Thank you.
President Edelmas, we were delighted that you've been able to join us. It's very good to see you, and thank you so much for that intervention, those contributions. Colleagues, we have a few minutes left, and I want to now go back and introduce our panel who have been listening to all of those interventions. Of course, our president, Dr. Pamela Cipriano, and our board member, Dr. Nora Eloise Barrona de Pineta, but who also will be joined by Dr. Sylvia Cassiani, who needs no introduction, and Dr. Jose Luis Cobos Serrano, who is the ICN board member, one of the ICN board members for the European region, and I know is known to many of you from the Consejo in Spain. Jose Luis, let me first come to you. You have heard those very rich contributions from 14 or 15 presidents. There seem to be a lot of similarities, but give us your reflections on what you have heard in those interventions.
Hello, everyone. Hello, Howard and Madam President. It's a pleasure to be here with all of you. Thank you very much, Madam President, because it's the first regional webinar, and so your compromise is satisfies for all people. Thank you very much. Muchas gracias a las presidentas.
So thank you to all the presidents and to Dr. Sylvia Cassiani. It's been a pleasure seeing you again and having you here, because indeed you are doing excellent work in the entire region. I think that that work is very important. Thank you as well to the FEPEN president. I wouldn't want to take up all the time by thanking everyone personally, but I'd like to continue what Howard was saying. The similarities between all the different countries in the region. As you know, in Spain, we have been working closely with all the NNAs. And I think that it's important to work closely with the ICN as well. Note should be taken of what has been said regarding the directives from the WHO. So if we take into account everything that's been said, all those problems, issues that have been mentioned are included in those WHO directive. And I think we need to see how we can collaborate in order to develop our profession in our countries. We cannot just sit around and wait for the ICN or WHO or our governments to do something. We need to be proactive. We have various issues. We've got employment issues and working environment, etc. But it is important for NNAs to work together. It is clear that there is a great need to increase and strengthen our leadership. And I believe that NNAs can help each other. We can see a clear example from a few days back where I shared something with the NNAs from the Latin American region. I told them that we have a webinar here in Spain, and we're given the opportunity for all nurses from Latin America to join this webinar on prescription. We've seen other webinars on specialization, etc. So there is great commitment. So it's important that anything that an NNA can share with anyone else should be shared. And as a member of the ICN board, I am going to ensure that everyone from the president to every single member of the board will commit to this and to work with the NNAs, to work inside the different countries, and working on nursing in general around the world. And I'll be happy to answer any questions that you may have. Thank you very much, Howard. Can you hear me? Hello?
Porque estoy teniendo problema con el internet porque estoy a las afueras en el campo.
I am not currently
soy
in
Sylvia
the city.
Calveira,
My name is Sylvia
la
Calveira.
presidenta de Uruguay, del Colegio de Enfermeras del Uruguay. Quería aportar mi granito de arena, un poco ratificando lo que todas las colegas de Latinoamérica dijeron, agradeciendo a las presidentas, agradeciendo a Pamela, Howard y en especial a
Howard, the opportunity to be here.
Sylvia, we heard you there. We've been trying to reach you, Sylvia. We did hear you. Sylvia, if you can hear us, if you want to take a couple of minutes to make your intervention, do that now, Sylvia. Sylvia from Uruguay.
Okay. Muchas gracias a todos y
thank you all.
Quiero un poco ratificar lo que todos los colegas de Latinoamérica dijeron. Nosotros somos países en vías de desarrollo, a diferencia de algunos de ustedes que están en países desarrollados, y las diferencias económicas en realidad son parte de la lucha diaria de lo que es la enfermería. Lo que nosotros deseamos, porque fue que planteáramos algunas de nuestras necesidades más importantes. Una de ellas es un poco colectiva en toda Latinoamérica, es que la enfermería se debe visibilizar más y los participantes del Consejo Internacional de Enfermería, todas las agrupaciones que lo componemos, sean más visibles en cada país y que nos tengan en cuenta. O sea, que seamos voz, pero realmente que seamos voz y partícipes de muchas decisiones que se toman y que a veces estamos en un camino lateral. Eso sería una de las cosas más importantes. Otra que ya sigo ratificando como en todo Latinoamérica es la necesidad del recurso humano de enfermería y de la capacitación de las mismas. En nuestro país tenemos aproximadamente 4.000, 4.500 enfermeras para todo el Uruguay profesionales, pero tenemos 23.000 auxiliares de enfermería que en realidad realizan un trabajo técnico y no se las menciona como tal. Por supuesto que muy mal remunerados todos, los no profesionales y los profesionales. A eso tenemos que abogar, a que todo haya un emparejamiento hacia la excelencia. Nosotros con respecto a lo que es la participación activa con respecto a niveles jerárquicos y ejecutivos, no tenemos presencia. Y eso tendría que ser una de las cosas que entre todos tendríamos que estar presentes. Cerca de los ministerios de salud pública donde se realizan las estrategias de salud de la población y donde nosotros somos partícipes importantes. Esta pandemia nos dejó presente y nos dejó como primera línea de acción y respondimos como tal. Entonces creo que es importante que participemos en forma conjunta con las estrategias y las políticas nacionales de salud, pero con una carga importante de representatividad. También tendríamos que participar en lo que es la parte de Organización Internacional de Trabajo, la OIT, cuando se realizan los presupuestos nacionales que se les va a otorgar enfermería. Estamos con salarios muy ínfimos, a los cuales, que algunos de los colegas, yo no lo dijo, tenemos que realizar multiempleo para poder llegar a las canastas básicas familiares. En nuestro país sí tenemos algo que nos enorgullece, que fue con respecto a esta pandemia, la vacunación, a la cual tuve la participación directa de la Coordinación Nacional y donde tenemos casi un 90% de la población totalmente vacunada con primeras y segundas dosis, un 70% con terceras dosis y ya hemos alcanzado casi 60% con segundas dosis. Era un poco ratificar lo que todos decíamos y que nos reunamos nuestros esfuerzos para poder salir adelante realmente, eso que nosotros deseamos que la enfermería tenga voz a nivel global. Muchísimas gracias a todos por la participación y excelente que estas reuniones sean más asiduas. Disculpen las interferencias en el sistema.
Sylvia, thank you. I'm so glad that we did manage to get your intervention in this session. And Sylvia, you raise an issue that I want to ask both President Cipriano, Nora, and Sylvia to give some reflections on. There was a strong theme in all of the interventions about the need for us to be more effective in our advocacy. Jose Luis spoke about the importance of us working together, and Sylvia just made the point about being more visible. So I want to get some reflections from our panelists on how can nursing organizations be more effective in the advocacy, the campaigning, the lobbying work that they do. And if you have any practical tips, any top tips about what we could and should be doing, please share those as well. Madam President, let me come to you first.
Listening to the numerous times that people did mention the need to influence their presidents and ministers, I think calls on all of us to look at our media strategies. How can we tell our story? How can we recruit others to lend a voice of support? And then the other is a very organized campaign, if you will, of setting up meetings to talk with your leaders, your elected leaders, your minister, so that they are able to hear the very same issues that we heard today. If you're in front of them on a screen, or if you're in front of them in person, they will have to listen to the struggles that nurses are having, the issues around the fact that the workforce has really suffered tremendously. And if they want to continue to have a health workforce in your countries, they are going to have to pay attention. And to be able to start that discussion with them and then others who are influential, I think is really important. The other thing that we haven't talked about is there are likely other organizations from other professions that will join in this discussion, because so many of our partners from other disciplines in healthcare were affected as well by the pandemic. I don't know their status in terms of are they suffering from the same working conditions and poor pay and unemployment, but clearly we have a real need to come together with collaboration around these mutual issues, which again amplifies our voice as well.
Thank you, Madam President. Some top tips there. Nora, what are your thoughts on how we become more effective?
Bueno, me uno a toda la opinión que ha manifestado la doctora Pamela.
I would like to share Madam President's opinion. It's important for the different organizations in our countries to pinpoint key stakeholders. We need to identify them, because among them, there might be different groups who might be key partners, but also other groups that might work against us. And if we get in touch with them, they could perhaps become allies and partners in this collaborative work that we need to carry out. We've talked about unity and establishing cross-sectional alliances, and I think it's clear that we cannot walk alone, because we need to work together with other leaders that represent nursing associations in our countries. We should have one single voice. And indeed, this is a time for evaluation in each of our countries. We need to see how we're working with our representatives, with educational experts, with NGOs, etc. We need to see it and evaluate all other possible partners that could help us strengthen the nursing profession. We need to open our doors to them. I am sure that we're doing really good work in this field, but we need to continue. I've seen in the chat how we can, a question that was asking, how can we work together? How can we unite our efforts with other countries? And I think we have that opportunity right here, right now. We need to establish strategic measures. We have the FEPEN that is helping us. We have other representatives in the region and other stakeholders that can help us, can support us, can help us with the lobbying, and they can help us together with the ICN. So we need to evaluate how these strategic partners are currently working and unite our efforts, such as Sylvia has mentioned. We've already carried out some sort of analysis of the needs in the region. We've been mapping those needs, and Sylvia has also included different associations from the region in the project. I think that's very important, including certain specialist associations, because we can see how those alliances with certain partners can help us to have and improve our outcomes, to meet the needs that have been mentioned today. So we need to look for those alliances, those partnerships that can help us strengthen our efforts and to work together, of course, with the ICN and WHO. Thank you very much.
Excellent, Nora. One voice for nursing. Sylvia, you will sit in meetings and hear people expressing views about national nursing associations that we won't hear. So you will hear, I think, sometimes when the association has been very effective, or equally where we've not been so effective. From where you sit, the conversations that you hear, give us your thoughts about what we can do to be more effective for nursing.
Gracias, Harold, de la pregunta.
Thank you, Howard, for your question. I just wanted to, if you allow me, before answering to what I have heard, I would just like to make a brief summary of this meeting today, because while I was listening to my colleagues, I was gathering different aspects, which are the opportunities that an association can learn from another. And also, I was also writing down some challenges. I'm going to tell you about the opportunities, and I'm so sorry if I've missed something, but it really got my attention what Colombia said, that has developed a national policy of nursing, and they have a strategic plan, 2020 to 2030. I think you should and you can also use this experience as how Colombia or the Ministry of Health of Colombia developed this policy. And maybe you can also use this experience to develop in your own different countries a national policy on nursing. The other example that I heard was Honduras. Honduras said that there has been an increase in the cap of the vacancies for nursing students for the emergency care and for community care. I think we should also use or learn from this experience. Paraguay said and talked about the law. Did very, very good the work of the national association in developing this national policy, which has been very interested, the work they did. You can also hear from the Paraguayan experience and to use this experience. And also Uruguay didn't say it, but I know that Uruguay has developed the National Commission of Nursing together with PAHO. It is a political national dialogue with the different strategic aspects to advance nursing. And finally, I would like to mention Cuba. Cuba has shown us a different advancement of nursing in the country, including the increase of the nursing students' places, and now they are coordinating a group of professionals. So these are important aspects that show the advancement of the nursing profession in the region. Yes, we do have issues, but the countries are moving forward. We couldn't have Chile here, but Chile has also implemented some progress in the training of nurses. Brazil, we don't have Brazil present here, but they had also worked towards the increase of the minimum salary for nurses. So they had increased the minimum salary in Brazil. We also have good examples from Venezuela and for Dominican Republic that unfortunately we couldn't hear. Now let's go to the challenges we keep on having, and these is what you had put forward. And I'm just going to try to make my summary of what I've heard. First of all, regarding to the work, to the employment, we're still facing serious problems of different employment or precarious work conditions, like Costa Rica said. Argentina said that many nurses have to have different employments because with one employment they cannot have a decent salary. Also with Uruguay, Costa Rica, they mentioned salary, the divergence among the different salaries of the different nurses and the different contracts. Ecuador, they mentioned the topic of the continuous education for nurses. It is something that we have to make more on this from the ministries, and we have to work together with the universities. And we also have to work together with the NNAs, together with the universities to offer continuous education for nurses. We've also heard how with COVID, the urgent need we faced, and now we have to move forward with this topic of continuous education. Another topic that really got my attention, and it is a challenge, is leadership. It is a continuous challenge, but Bolivia and Peru, they've mentioned that we don't have a directorate of nursing in the ministries of health, but we also know that this is a problem in many other countries of the region. Some countries in the region have a national board or a national lead at the Ministry of Health, this national nursing lead, but some other countries don't have this figure. Also, we've heard about the transforming leadership. It really got my attention what Guatemala said when they expressed their views about the importance of the transformative leadership. It is a concept. And now, Howard, I'm going to try to answer your question. It is a concept that many times I hear this term that NNAs have to make more progress on a leadership, a type of leadership which is a game changer. It is a transformative leadership. Maybe we should dwell into this concept to really try understand what it means. And finally, I would like to talk about the migration, which has also been mentioned by Colombia. Colombia mentioned the issue they face with migration, the importance of retaining nurses, because Colombia is suffering this issue of lots of nurses wanting to leave the country. And also, I completely agree with FEPEN, with the president of FEPEN, when she mentioned the importance of creating a task force. And if FEPEN follows this project, if FEPEN launches this initiative, us from PAHO will be very delighted to work together with you. I am sure that ICN also with Nora and with Lisa and everybody together can move forward. Howard, I don't know if I was able to answer your question, but that's basically what I wanted to do. It's just a summary of what I have heard. Thank you very much.
Sylvia, it was a fabulous summary. I think we should invite you every time to summarize these discussions, because it was perfect. So thank you for the job that you've done. Colleagues, we're over time, so we're going to finish in just a moment. I'm going to go to Jose Luis just for a very short final observation, Jose Luis, from you, and then I'm going to go to Madam President for her closing remarks. Jose Luis, to you first.
Muchas gracias, Howard.
Thank you so much, Howard. Well, I think we all learn. We learn every day from each other, and I think this is a clear example of what we need within ASEAN with all the different NNAs. Madam President told us in our meetings that we have to increase the contact with our NNAs, that we have to look for other possibilities to really be closer to the issues faced by our nurses. And this afternoon, for me, I will leave this webinar with this idea that we have opened up a new door within the ICN so that the NNAs can express their issues, and also that the ICN can also express their view, that we are very much in line. This is the main challenge we face in our organization. The pandemic has taught us a lot in order to overcome issues, and now we're in the right condition, not only to weep and to sob about our issues and problems we face, but also to think about solutions. And as Sylvia Cassiani just said, we have a great opportunity to have a joint collaboration. We have closer associations, like, for example, the WHO, the PAHO, and other organizations like ILO. They are waiting for us, and they're waiting for us to collaborate with them. So we have to be active. We cannot just sit down to ask them and to have them solving our issues. So thank you so much to ICN for this opportunity. Thank you, because I believe this is the way forward. We have to have this kind of fora to share, and the new technologies allow to do this. Even in a cheaper way, we can have these virtual meetings, and then we can also give all these conclusions to our CRN or the governing entities, the board at the ICN, to make decisions. Thank you very much for the initiative. Thank you, Madam President.
Thank you, Jose Luis. Madam President, final word to you.
Okay, so I want to thank everybody for their participation, for our special guests and leaders from the ICN board. Sylvia did provide a pretty amazing summary of very country-specific as well as regional issues. And I echo that. I mean, we can take away from this discussion really important details and scenarios that describe the workforce shortages, the pay issues, the strife that nurses are under, whether it's unemployment or having to work multiple jobs or not having safe working conditions. We heard you loud and clear about the need for leadership, continued leadership development, and our ability to come together to support you in those efforts to influence laws, regulations, policy in your countries. So this just only strengthens our ability to come together with a resolve that we want to help all of our NNAs and all of our regions to address the unique issues that they have, but also we know that we share many, many of these issues around all of our regions. So I want to thank everyone for your honesty, your clarity, and your commitment to working together to be able to make ICN's impact even stronger. Our ability to influence change in all of these areas is what it's all about. So thank you. And again, I thank Nora in particular, as she's had many conversations and connections to make sure that we all got together correctly. And thank Jose Luis for his presence, and as well as Sylvia and Howard and all of our staff who helped make this possible.
Madam President, thank you. Let me add my thanks in particular. I think this is the first time that I think that we have had 15 presidents of associations on the same webinar. So your commitment, your knowledge, your expertise, your time is hugely, hugely valuable. Thank you for that. I thought that Sylvia may also have given us our topic for our next webinar on transformative leadership. Perhaps that's something that we should think about as well. We will write this up, colleagues, and we will share it with you. We are finishing our day here in Europe, but I know that you have the rest of the day ahead of you. So I thank you for your time. I wish you well. We look forward to seeing you all again in the not too distant future. Take care. God bless.